Good morning. I wanted to pop up here so I could see all your faces. Thank you so much to the roundtable and everyone in the room for inviting me here this morning to speak about the Justice Reinvestment Initiative. Curious, I'm learning so much from you from being here this morning and sort of being like, hey, we do that. Like, we do that, but we don't know we do that. So really appreciate what I hope is a good exchange of ideas and dialogue. And curious, before I get started describing what the Justice Reinvestment Initiative is, if anyone here in the room has heard of it, what's the familiarity level of what this project is? Anybody heard of it? Have a few show of hands. Well, good. So then I really am an expert because none of you have heard of it. I'm already off to a good start. So it is, the Justice Reinvestment Initiative is a project that was first federally funded starting in 2010. So we're new-ish, but we have now had 30 states participate in this program. So we are very quickly filling in the states across the map. And so glad I can represent the work that we do for adult corrections reform, but I do not have a level of experience in juvenile justice reform, so happy that the judge can be with us today to talk about the kids that are going through the system as well. So the Justice Reinvestment Initiative, there are some core elements to this program. One is that it is data-driven. We rely very, very heavily on the data, and the data is not just the numbers. The information that we're able to gather from local government, state government, pretty much anyone who we can get data from, we take it and we analyze it. By the time we're done with our data analyzing phase, we have looked at thousands and thousands and thousands of records. It's a researcher's dream in some ways. It's a really great opportunity. But let me back up a bit. So before we even get there, how does a state participate in the Justice Reinvestment Initiative? This is a public-private funding initiative. It is generously funded by the Department of Justice Bureau of Justice Assistance, and the Pew Charitable Trust is our private funding donor. So it is a partnership that is able to, with those the differentiation in funding, cover a range of topics that we're able to look into. If a state is facing rising correction costs or different criminal justice issues, they have an opportunity to apply to become part of this program. And it's a fairly rigorous threshold that has to be met before a project is initiative. You have to have all three branches of government agree to participate. The governor, the chief justice, the Senate president, the House speaker, all of them have to sign letters and indicate their support for going through this project. If that cannot happen, we do not go forward. Both parties, even if it's a state where there is one dominant political party, there has to be a demonstration of support from both the Democratic and Republican Party before going forward. There has to be agreements that all of the data will be provided. So data sharing agreements are sort of entered into and signed over so that you have a technical assistance provider that then has the opportunity to analyze that data independently. So the Council of State Governments Justice Center is one of several technical assistance providers. We also see assistance provided by the Pew Charitable Trust, the Crime and Justice Institute. There's a couple other folks who are doing this work, and I'm happy to be here today to try to represent all of their great minds and their great thinking. So the state then has an opportunity. They have their unique problem statement. I will say that back in 2010, I was in Michigan at the time. I wasn't with the initiative then, but rising correction costs was really what brought state leaders to the table. I think everyone in this room, whether you have familiarity with the project or not, knows and hears about the spiraling corrections costs, how many states spend more on corrections than they do on education, and that those costs are simply rising, that the incarceration rates here in this country are higher. I heard about the Finnish example. You don't even want to compare us to what we look like with other countries in terms of corrections. By the year 2015, states will be spending well over $57 billion on institutional corrections. It's a lot of money that perhaps could be spent differently or better. So the idea here is that we use a very sort of detailed process to uniquely come into a state to look at what is driving their corrections issues and their corrections costs. And we do this throughout the course of 1 to 3 years. So once you buy in, you have us. We don't go anywhere. We sort of in some ways take up residence in the states where we're working to make sure that we not only propose policy solutions that work, but we stay to help implement them and sustain them, track them to see if they're working, set up performance metrics, and continue that cycle of data collection and stakeholder engagement. And stakeholder engagement is a good place to start because before policy options are even developed or introduced or discussed, there are literally hundreds of meetings that happen around the state. So that happens at the local government with jails, sheriffs, law enforcement. It happens with behavioral health experts. We do focus groups with treatment service providers. We certainly talk with victim advocates. We talk with business community. We try to have as a holistic perspective as possible going into this idea of proposing what changes need to be made to a correction system to avert rising costs and produce safer outcomes for communities. So that all takes place as policy development, analysis, stakeholder engagement typically lasts around a year. And then a legislative package is typically introduced. And more often than not, we actually have a really amazing track record of getting legislation passed within a session in a short period of time. That is namely because of the amount of buy-in that has to happen before the process even starts. Criminal justice is one of those really funny things that makes for some of the strangest bedfellows. The leftist left and the rightist right stand together arm in arm and support these policies. Sometimes we find ourselves in meetings and we're like, I can't believe these two people are talking. Like, what, how did we get here? And feel very fortunate that this particular issue is able to sort of galvanize that kind of support and move it forward. We see that at the local level, the state level, and we're seeing it at the federal level as well. So we should be able to get something done, right? Back to the poll you all did in the very beginning of it. There's fluency on the issue, there is relationships, there's policy, there's buy-in. So there are many reasons for the success of this effort, but we're all hoping to see it continue, and hopefully then it can also be a model for change that you're all looking to advocate for as well. So after the policies are enacted, there is a stage of implementation support that lasts anywhere from 12 to 24 months. So this is and this is where I've spent the majority of my time in this project. This is what I call the rubber meets the road crew. You have these, in some ways, these really grand vision statements of how to get people behind the walls, out from behind the walls, and put them into the community. So many of the driving factors to our correction system are not first instances of crime, but they're recidivist crime. So these are individuals who are not committing their first crime, but their second, their third, their fourth. So you have to look at these individual needs. We call them criminogenic needs in our world, but they're many of the things that you all are talking about today. Who are their social networks? How do they respond when they're faced with a problem? Do they have a home? Are they able to access a job? Do they have food? What are their circles like? What are their neighborhoods like? What are the access to things that they have that sort of help them to live a lifestyle that doesn't make their response to a situation be a criminal activity? How do we have a cognitive behavioral intervention that changes the way that individual thinks so they don't respond in a way that puts them back behind the walls? How do we get them doing something differently? How do we change that recidivist behavior? And when you have these ideas, we do things like housing program vouchers. we talk about things like, job readiness. We talk about how, we have programs like Thinking for a Change that we run within the correction systems, and we also run in the communities. But, how do you then, we're talking about a lot of people in a lot of communities, and quite frankly, a lot of money. So how do you shift that? You pass legislation within 12 months, but now you're taking a system that has been built up for decades and you want it to change on a dime, because pretty much we pass legislation that's effective a month later. So how do you plan for that? How do you make that happen? And that's where this implementation support comes in. And this is where the reinvestment piece of the project comes in, because we are helping state governments spend money and avert rising costs so that they can address other priorities within their state budgets. But you can't change a system so comprehensively without making investments into that system. You can't provide this type of lasting change, this programming change, these types of ideas if you don't then think about how it's all lined up and operationalized and start to change that. And that process can take quite a number of years. Oftentimes, we have a really good start and a roadmap and a plan within that 12 to 24 months, but then we need even longer than that to make it happen. And this is where we set up these performance metrics, and we do data collection, and we teach states how to look at the data, realize the red flags, be accountable to that information, transparent about that information, report it to the public, the legislators, the appropriators, to keep these things happening. So to the reinvestment piece of justice reinvestment, a lot of it, reinvestment is a really amazing word in this context, and I can tell you that most states it's an upfront investment, not necessarily a reinvestment. And it's an upfront investment on the promise of calculated cost savings and costs being averted. So we see at the same time legislation is being passed, we're also seeing an appropriation being made to help implement those specific changes. So we have a number of states who have done this upfront investment, and we have other states who have actually done a statutory formula. I'm going to talk about Pennsylvania, who said, huge system, Pennsylvania, and said, we're not going to do an upfront investment. We're going to create a statutory formula that requires the legislature on an annual basis to calculate the savings attributed to their justice reinvestment policies and mandates that those savings be redirected into programming efforts. So this sounds really cool, right? Because it's like actually requiring the legislature to look at the policies they enacted, sort of this whole idea, right? Figure out what your savings are, and then not sort of requires them to then realign those savings and not being able to sort of not give them back, right? So this is the idea that we sort of, in some ways, Pennsylvania was the only state where we did this as a TA provider in our policy options, because we were really worried that maybe the money would never come, and then what would happen, and how would we get some of these programs off the ground and running. So what we saw in Pennsylvania is within the first couple years, there really wasn't much of a reinvestment because these policies take place to actually realize the savings. But then we saw within one fiscal year, the savings attributed to the program within a 12-month period jumped from $12 million in savings to $38 million in savings. And so the reinvestment went from $3 million to $10 million. So within 1 year, there was pretty significant change within one state system. So where did that money go? It went to victim services. It went to looking at risk assessment tools, and risk assessment tools are something you may have heard about in the news lately, but it's this whole idea of using sort of to the extent possible, a non-biased assessment tool to figure out the likelihood of somebody recidivating. And that helps then to determine what programming that individual needs. Some judges and magistrates will use that tool to think about what appropriate sentencing and punishment and sanctioning options might be as well, too. Pennsylvania also reinvested in policing, county probation, community reentry efforts, and other state parole efficiencies. So some of you might be thinking you're reinvesting all your money back into the criminal justice system. And that is, for the most part, true, but there's actually a conversation afoot now within the project about, what could we do differently? I will tell you, in the very beginnings of this project, before I was a part of it, the idea was to take the calculated savings from corrections costs and put it back into the community, into non-correction domains. And they set up that type of a project in Kansas, and it did not work. And so there was this idea of, okay, we're pretty honest here. We can take that result. We'll figure, why didn't it work? And we're going to take a harder look at that. But what we have found is that there is so much need within the correction system to address these needs that the funding has stayed within that system. So it varies significantly. Let's see, there's this idea, like I talked about, reducing recidivism, improving supervision outcomes. So we know from the research that individuals who are in the community tend to do better than individuals who are behind the walls. So how can we make community supervision more effective, and not just more effective in terms of keeping the individual from being incarcerated, but from keeping the community safe as well, not just the community where that individual may reside, but the communities where that individual may go to commit crimes. So how do we think holistically about making sure that that supervision is wholly effective for the individual and the communities that might be impacted? We look at behavioral health. We're seeing more and more reinvestments into mental health services, substance abuse treatment services, other issues that we really see as being drivers of crime. We know that within our populations, and it pretty much doesn't matter what state you go to, there is a tremendous amount of individuals within the prison system who have been evaluated for a substance abuse need or a mental health need as well, and needing that kind of programming and treatment. So that kind of shifts me to West Virginia, which is another case study that I'd like to talk about that kind of went a different route, where they did an upfront investment, where they appropriated nearly $12 million over the course of 3 years to support expanded substance abuse treatment services. So one of the problem statements in West Virginia was that they had the unfortunate distinction of being a state with the highest rate of death per accidental drug overdose. And they had a large number of individuals, a lot of judges. If you go into West Virginia and you talk to the judges, they say, I don't want to put this person in jail, but if I don't, they're going to die. So what's my alternative, jail or death? So they would be putting them into jails and state prisons in order to save their lives. And we believed them. We had no reason not to believe this was true, right? But what's the appropriate intervention there for somebody who is going to die if they stay on the streets or put them behind the walls? There has to be a better way to do this, right? So the idea in West Virginia is it was a collaboration between multiple state agencies. It was their behavioral health agency, it was their jails, it was their community service providers, it was their Department of Corrections. All of them came together and established a grant program with these dollars because they realized that the problem was incredibly local. So the state provided local grant funds on a county basis to be able to provide and increase substance abuse treatment services for individuals at home in their communities. So in order to be eligible for this grant program, it was required that they show a partnership between the criminal justice service providers, the behavioral health service providers, the community folks. They had to have a place to meet, the place to provide the treatment, all of those pieces, and then a grant was provided. They were given training, because a lot of behavioral health treatment providers hadn't previously worked with individuals who had these criminogenic needs that needed to be addressed. And what we've learned from the research is you can't just treat the substance abuse or treat the thoughts that lead you to crime. You got to treat them both at the same time as co-occurring issues to kind of take a look at. So West Virginia, totally different upfront investment, a very local county program driven to try to address their substance abuse needs, and they've seen tremendous results from that program. So I have a number of states here, and I want to give a shout out and a thank to Dr. Samantha Harvell from the Urban Institute. The Urban Institute, along with other organizations, helps to provide assessments of this program. They do data collection, they tell us what's working, what's not. They look at the policies. This is another piece that I'm hearing from this morning as well. We have independent evaluators of the policies that we enact and the work that we do. And CM is actually pulling together all of this information to release an assessment report of the project later this year or early next, and she's given me all of the states who have reinvested significantly. And I know that just quickly, there are a number of states that I think have significant reinvestments. Just to tell you, North Carolina, more than $46 million. Oregon, $98 million. This is a significant amount of money that's being, for lack of a better word, reallocated into different services and being provided in a different way to try to produce different outcomes from individuals being behind walls. And we are seeing declining prison populations, declining crime rates in many places and across many categories. And so we're hopeful that this continues to work and that legislators will continue to appropriate these funds going forward, because we're able to demonstrate that the project works and that the process makes sense. So with that, I think I'm handing it over to the good judge to talk about the juvenile court.